Welcome to the NeuFit Undercurrent podcast. And today I am super excited to welcome Lisa Chase. And she is a physical therapist in the St. Pete, Florida area now, but also has reach at Michigan State University, where she is a clinical instructor in the osteopathic medical school. And she runs a really cool program that several osteopaths and physical therapists have been going through, and other professionals in manual therapy. So there, technically, she's the co-chair of the Functional Manual Medicine Certification Program. She also has a wonderful practice called Back to Normal, has experience in professional tennis, working for many years, touring with the athletes, and has a variety of expertise in osteopathic manipulation, biomechanics, various soft tissue techniques, and also with the NEUBIE. So I'm excited to dive in with you, Lisa, and explore all of that. Thank you so much for being on the show.
Well, thanks for having me. This is great. I'm excited to have a chat and explore some different things that we've been doing.
Yes, yes, I love it. So let's start with your experience. I know this is a big part of what you do, going to Michigan State a few times a year and teaching these continuing education courses. So it's part of the DO, the osteopathic program at Michigan State. And can you talk about some of what you're teaching there? And then of course that'll be a good lead into some of these techniques that I know you've been using, that you love, I know in our previous conversation you called them game changers. So
Yes. Yes. Throughout my career, I have, looked and searched for those game changers. Well, let me take you back for, when I was first starting to practice, and I was in a spine center. And this was fairly early in my career. And I felt like I just did not know how to treat the spine. And I was working with all these incredible physical therapists, and they were getting all these really difficult patients better. And I'm like, what is your secret? How are you getting them better? And they all said, you have to go to Michigan State. And I was like, okay, sign me up. I'm in. So that began my journey of going to Michigan State. And it literally, I talk about this all the time when I teach to new therapists, that it is absolutely the number one game changer, because it gave me a framework. So the program, it is in the College of Osteopathic Medicine, and they have faculty members that are there working with the osteopathic students. And then they have adjuncts like myself and others that are PTs, DOs, and MDs that come in to teach. And usually it's anywhere from a 3 to a 4.5 day course. And you really learn the foundations of looking at the whole system and figuring out, what are the best techniques to use to restore function. And so much of that is linked to the nervous system. And that's why working with the NEUBIE has been so much fun, because it's just another piece and another layer where we can tap into the nervous system and make really profound changes.
that's awesome. I love that multidisciplinary approach with DOs, MDs, and PTs, and that emphasis on the manual therapy. So when you talk about that program and how it's impacted you, can you share for everyone listening here some of the either assessment or treatment techniques, or I mean probably both. Obviously, you got to start with the assessment and know where to go. I know that's a big part of what you're doing, but can you share some of the techniques that really have moved the needle, have been those game changers for you, and just give everyone a little bit of education on what some of those are and how they work?
Yes, absolutely. So like you mentioned, it's the manual types of techniques. So part of the certification course is not only going through the foundational course, but going through various courses like muscle energy. So muscle energy is one, cranial sacral is another, joint mobilization, myofascial. So these are, and then of course our exercise course, which blends much of it all together. But the thing that I would say is the biggest game changer is muscle energy. And when I talk to faculty like Mark, who, he is my partner in the Rehab Links, Mark is just a wealth of information and has taken all sorts of various courses. And every time we meet, I'd always say, Mark, like if you can only have one tool in your bag, what would it be? And it's always muscle energy. So muscle energy is an amazing tool that really, it switches the nervous system. So it's looking for a segmental dysfunction somewhere along the spine. It could be, in the pelvis. It can be in the extremities. So you're looking at the muscles that are attaching around that joint, and you are working within the bind and ease of that joint and the muscles that attach to it, and being able to just give very gentle muscle contract, relaxation types of cues to the patient. And then you move to the next barrier. And even my clients that come in, they all kind of know how I do my assessment. And they're like, what is this? This is just, I've never had this before. And it's just unbelievable how, you just do like the littlest thing and all of a sudden I can move again. So it's super powerful. Definitely the making the diagnosis and figuring out what is the best level to address. And then as soon as you do that and you work with the muscles, which ultimately are working with the nervous system, it flips that switch. People can move again. We get muscles that are inhibited to now fire, and muscles that have too much tone to quiet down.
And when you, in order to figure that, when you're doing your assessments, are you doing observation of gait? Are you doing manual muscle testing? Are you feeling tissue tone manually? I mean, what are your kind of main assessments?
So I do like to look at how people move globally, because I am definitely not somebody who is, let's just say, a purist. I like to use various systems. So I also have done some teaching with SFMA and FMS, where they're looking at more global movements. And so I combine that with looking at how people move in various different, directions. And then I look at how the joint mobility at the different joints. So is there something that is restricted? Once I kind of hone in on the main areas and figuring out, is it truly a mobility issue or is it a stability issue? Because if it's a stability issue, I'm going to go down a different road. So I like kind of determining, okay, if it's mobility, then I'm going to mobility test the areas that I anticipate to be restricted. And part of my assessment is looking at the firing patterns and the movement patterns of different muscles. So say, for example, glute max, just looking at the overall firing, not just is the glute max firing, but looking at the overall pattern. And then if that is a dysfunctional pattern, then looking at what could inhibit the glute. Is it, a hyperactive hip flexor or tight anterior capsule? Is it L5S1? Is it, something, sometimes it could be something in the viscera that can be restricted. So I want to figure out why that's inhibited and what's inhibiting it. And that's where I love the exercise course in complement with muscle energy, because it allows us to look at movement patterns and quickly go, okay, how can I get the biggest, quickest outcome, which is by, treating those areas that are going to influence that inhibition or that tone. And then I love to, use the NEUBIE right after, because it then just reintegrates that movement pattern.
Awesome. So thank you for that description on assessment and muscle energy. In terms of muscle energy, so when you're doing it, you said there's subtle contractions and relaxations, more like isometric contractions. And would you be providing light manual resistance or cueing or?
Yes. You're gonna, it's very, really pretty light, because what we're trying to do, particularly in the spine, is we're trying to get those real small, like the multifidus, to fire. So if they do a real big contraction, which you can do in the pelvis, where I want to create more of a bigger, stronger contraction to get a bigger bone to move. But when we're talking about the spine, it's going to be a smaller, much smaller gentler range of motion where I can get localized activation so I can change what's happening at 2 segments.
That's awesome.
Yeah.
It does feel like a manual way of using the NEUBIE, getting that more kind of precise. Yeah, I love it.
Yeah.
Can you also share, you mentioned some of these other techniques, myofascial, cranial. Can you share a little bit about, just at least at a high level, what those are and how they work?
Yep. So the cranial system, so you're evaluating the cranium, right? So there are these little, I'm showing you as if they can actually see me, but these little sutures that are within the spine. So I'm sorry, that are within the skull. There actually are some movements in there. So it's more the fluid balance that you're trying to influence, and you can actually influence the joints. So these are very, very gentle techniques that can impact not only kind of the head and neck, but they can influence other parts of the body. Like I've had people come in with low back pain, and because of the dural connection from the occiput down to the dura, down to the sacrum, you can make a change all along that. So sometimes you're treating sacral mechanics that influence headaches. Sometimes somebody has headaches and neck pain, and you're treating the head and neck, and you can influence back pain. So those are very, very gentle techniques. Myofascial, you're working within the fascial system. Again, these are also very gentle techniques. I will, this is just using the hands and feeling where there's a restriction, and then you're just moving with that tissue and trying to get the fascia to release. I couple that with, I did some training called MELT, where you're using foam rollers and small balls to then give some tools to the patient to take home so they can decompress their joints, they can rehydrate their fascial system and maintain from session to session.
That's awesome. Excellent description there. And then the other thing that you mentioned a couple times here as part of that curriculum, and one of the real impactful techniques for you or approaches for you is what's in that exercise class. And exercise, obviously is a very broad topic. So can you tell us a little more about what that means to you and what's being covered in that portion of the curriculum?
Yeah. So when I took the muscle energy, like I said, it was definitely a game changer. But then, you come home, you're doing these muscle energy techniques, which are great. But then once again, how do you maintain what you're doing from session to session? And in the exercise course, we look at the upper quarter and the lower quarter. And there's a series of movement patterns that we evaluate. And with each movement, we help you identify, okay, for example, if the lower trap is inhibited, what might inhibit the lower trap. And then we're going to look at very specific manual techniques that we can do that will turn that lower trap back on. Then once we turn it on, then it's selecting the right exercise to get that muscle to fire and or to keep, for example, that lower thoracic spine to extend. Because we find that when that lower thoracic spine gets more flexed and it gets rigid, which, when we're sitting and typing on a computer, that's a very common, thing to happen. So we give things to help self-mobilize that thoracic spine and then do the muscle activation. Because a lot of times I find that patients are doing exercises that just reinforce, and I'm sure you see this with NEUBIE as well, right? It's reinforcing the wrong pattern or the wrong activation. So it's great that, we can have a technique that one restores motion in a joint or tightness in a muscle or fascia or scarring, and then, gets muscles to reactivate or to quiet down. And then we can pair that with, an exercise then that they can go home with and they can maintain. And then we will teach techniques of how to do self-mobilizations, how to teach patients. For example, we use the pelvic clock, and a lot of people might know about the pelvic clock. Mark actually took the pelvic clock to the next level, where he looked at how the therapist, and eventually you can teach the patient this, how you can tell where there are certain restrictions in the spine by moving around the pelvic clock. And so by doing that, you know, even after I've treated somebody, I always go back to the pelvic clock to see, is there still a restriction in, you know, in the pelvic clock? And sometimes it's more motor control, and other times it's still more mobility. So that's always my final check to see if they, I always tell my patients, I'm going to clean your clock. So, so, you know, by making sure that they've got a clean clock, I know that their motor control is good, as well as their mobility in the spine and pelvis are moving the way they need to. And if not, then I teach them, okay, if this part of your clock is restricted, you're going to self-mobilize and then retrain. And then you teach them how to, you know, take care of themselves. And so, I mean, I've used that a ton. I had a client who was a big marathon runner, and she hated the pelvic clock. When we first started the clock, she's like, I just hate the pelvic clock. And I said, trust me, one day you're going to thank me for the pelvic clock. And she was in London running a marathon there. And she emailed me and she's like, now I get it. I love the pelvic clock, because she was able to figure out, well, we were in different time zones, and, you know, she could look at the pelvic clock, see where she was restricted, and she could get herself moving again, get those muscles firing, you know, right before, you know, she's getting ready for a big race.
So if people are listening to this and thinking, that sounds fascinating, what is the pelvic clock? Can you give us a quick description of
so the pelvic clock? So if you think of somebody is lying on their back, all right, and if you're looking straight on to the pelvis, and if you use the belly button, right, as a marker, above the belly button is the top part of the clock. That would be 12 o'clock, and the bottom is 6, okay? So if I have my hands on the front of the pelvis, and I think most people listening would know what a posterior pelvic tilt is. So if I move into a posterior pelvic tilt and I'm rolling my spine towards the table, that is flexion. So I'm looking from an osteopathic perspective to say, can the facets open? If I'm going down into 6 o'clock, I'm looking at can they close? And then if I start to move into the other quadrants of the pelvic clock, so let's just say 7 and 8, and they're stuck and they can't go into 7 and 8. Well, that is challenging the spine to side bend and rotate to the left. So I know something is stuck and can't move on that left side. So now I can either use a manual technique to correct the mechanics, or I can give them some exercises to do to free up the restriction and then retrain that control. So it's looking at the different components of 12 and 6, 3 and 9, and then going all the way around the clock and making sure that everything is moving well, both from a mobility perspective and a motor control.
That's great. Thank you. Thank you for that description. Want to make sure we're all on the same page there.
Yes.
Everyone understands that. A couple of things that you mentioned about that exercise approach. I mean, of course, I think I totally agree with that in terms of wanting to maintain the work that you do in practice, helping people get the right cues and specific movements to activate the right muscles in the right way and do all that. And it was interesting, you mentioned, you know, you want to make sure you're doing it right because you want to train the correct, you know, or optimal improved pattern rather than doing it wrong. And you know, how the NEUBIE might play into that. There's kind of two perspectives. So it's an interesting little sidebar discussion here. But if you look at it, there's two ways to look at it. One is you can say, okay, yes, you definitely want to be sure to make, you know, maybe extra certain to make sure that the patient is moving well with the NEUBIE on, because there's so much sensory input, so much of this afferent signal going, that it's going to accelerate the process of motor learning. So if they're moving poorly, in principle, at least, you could potentially cause them to learn a poor pattern more quickly.
Yes.
I think then, fortunately, that's countered by the mapping process and identifying where the deficit is, and by providing the input in an area of deficit, you make it much more likely that the movement patterns will be beneficial, will be more optimal, will be more along the lines of what we're looking for. So since you brought that up, I just wanted to share a couple of thoughts there, because that in and of itself is an interesting topic of conversation, because there's a few
It
different
is.
points there.
And I would say, sometimes what happens is patients come in and they're in so much pain that sometimes it's hard to even really do any manual work. And so that's where I love to like pull in the NEUBIE. So then I might reverse it and do NEUBIE first, map them, try to get some of that, threat bucket reduced, and then go in and do some of my, manual treatment. So yeah, it could really go both ways.
Yeah, excellent perspective. Thank you for that. I think people listening will appreciate that walk through the curriculum and that program that influenced you and that you're now teaching and sharing with other professionals. So I appreciate that. And let's transition now into the next phase of your story. Another part of your story. So can you share with everyone listening your experience in professional tennis?
Yes. So again, a connection to Michigan State. I was teaching at Michigan State, and several of what we called the primary healthcare provider. That was the role when you're on the tour. And they came and they were taking some of my courses. And at the time, the person who was heading up that department was really looking to expand the skill level that the players were asking for were therapists that had really high level manual therapy skills. And Michigan State is, I think one of the superior programs that really gives those tools. So several of the therapists had come to the course, and at that time I had worked in sport but never professional sports, and so several of the therapists after that course said, hey, we've got a tournament in Amelia Island. I lived in Jacksonville at the time. You want to come and check it out? And I was like, okay, sure. So I went and was in the training room, and at the time I'm not an athletic trainer, so it is a very different environment than when you're in the clinic. And so they asked me to start treating some of the players. So I started treating some of the players, and they loved it. So then I was invited to the US Open, which is a whole another eye-opening experience, to be at a very big event like that. And shortly thereafter, they asked me to come and join the tour. So that started my journey on, really integrating much more, sports medicine, athletic training on the field. So, and I use these Michigan State techniques. There's lots of pictures that are out there, from me at Wimbledon on center court, and you can see I'm doing, some specific evaluation techniques that we learned at Michigan State. So you can use these techniques on the court very quickly or in the training room. But, essentially you had a team of people that traveled around the world, and we both, would set up the training room, and we help, our players get ready for, preparing for their matches. And then obviously, after their matches, if they had an injury on court, we were the ones that went on court. And, within a very, short period of time, 3 minutes or less, you're having to kind of figure out what's going on, and, implementing some kind of quick treatment strategy or taping technique so they can, finish their match. And then it's managing, if they have a serious injury, which certainly happens in professional sports, it's following that player through, helping to make sure they're getting the right care wherever they are in the world, making sure that they're, seeing the right therapist and on track for when they're going to be returning. We also conducted physicals, which would happen once or twice a year at different tournaments, where we would, provide a service where we would have a whole team of people that would come in to do those physicals and help, guide the therapists on, any kind of health and, wellness kinds of recommendations. So yeah, it was a great experience, and got to work with some of the best athletes in the world, and an amazing sports medicine team that where you're working with physicians, and you're working with practitioners from around the world, which is really fascinating. I think many of us, right, we're just used to being in the United States and treating here, but it's a whole different perspective when you have to communicate with different cultures and languages, and just different philosophies, and yeah, and on top of it, dealing with the media, and what that means to be in a very highly visible sport. So it was a great experience, and I learned a lot, and yeah, it was a lot of fun.
That's great. That's great. There's a little bit of a tennis theme on this podcast. About 5 or so episodes ago, before this one, we had John Isner on, who's been
Yes.
one of the highest ranked American tennis player for the last many
Yep.
years.
Yep.
And
I heard that. It was great. It was a great podcast. Great to see that he's utilizing that
yeah,
technology.
yeah,
Good for him.
that's cool. Well, it's great to hear your story as well here, and it's fun to get those glimpses into professional sports generally, and tennis, because it's a unique, more of an individual than a team sport. Different dynamics in terms of travel, staying in one place for longer periods of time, and just some interesting nuances in tennis as well.
Yes, absolutely. Yeah, being an individual sport, it's definitely unique in that way.
Yes, and you mentioned the essentially the collaborative nature, or the team care nature, team care dynamic that you had there, where you're working, coordinating with other professionals and things like that, and knowing our conversations, and your perspective on your private practice in St. Pete, Florida. I think that's a good segue into talking about Back to Normal, because there's echoes of that same sort of team treatment dynamic, collaborative team structure dynamic there. So can you tell us now a little bit about your private practice? Introduce us to what you're doing at Back to Normal.
Absolutely. So you're correct. So my experience on the tour, plus experience that I had previously, but certainly working in a team environment, and working with professional athletes, where it's not just about the injury, it's so much more. You're treating the whole entire athlete. So, my vision for Back to Normal is, promoting whole body healing to get you back to normal. And so everything that we do is looking at the whole person. And when I started off just myself, but my vision was always to have a team of professionals in-house, plus a team of professionals outside in the community that we can collaborate with. Because sometimes physical therapy is not what somebody needs. And it's important to me that I help to try to give some direction for my patients if I'm, not the right fit for them. So within our practice, so obviously we have physical therapy, and that is how most of the clients come to see us. And a lot of times it's, patients who have been, and they've been at other places. They've either had other physical therapy, they've had chiropractic, they've had injections, they've had surgeries, and they haven't improved. And so oftentimes they kind of come in very skeptical about, well, what are you going to be able to do to help me? Because I don't, and I'm sure you experience the same thing with NEUBIE, because certainly having NEUBIE as a tool is a big influencer on how much you can impact somebody's recovery and their pain. So from that, it grew to bringing on nutrition. I feel is a really big, important component. I've had several patients that I've seen that came in with what seemed like musculoskeletal pain around their abdomen and rib cage, and it ended up being their diet. And so being able to listen to somebody's story and to figure out, where things are coming from. And that's a big part is, for us here is looking at, well, is it the musculoskeletal system? or are there other influences? And then being able to we have a functional nutritional therapist who can really look at, gut health. I mean, to try to strengthen the core and the gut is very, or the abdominals is hard if you have gut issues. So being able to have a professional on our team who can address that. And with each evaluation, they get a complimentary, session with that nutritional therapist. We have Pilates instructors, and Pilates is a big part of how we help people regain positive movement experiences and integrate the core and those muscle activations. And we will pair that with NEUBIE, which is a lot of fun. Health coaching and fitness as well is, so it's working with them while they're in rehab and then transitioning as they move out of rehab. And, and it's looking at, even the stressors. And, we know with COVID and all the things that's happened in the last couple of years, I mean, stress has certainly been a huge piece. And, thank you for, your work with, the threat bucket and how NEUBIE plays a role in that. I use that every day to explain to patients how, these various, stressors are going to impact their pain, their ability to recover, how much we can impact their training. So, so we really, do utilize that. Now, Jason Waz, a shout out to him. He's the one who introduced me to NEUBIE. Him and I have been colleagues for a long time, and we've shared technologies back and forth. So he's either calling me or I'm calling him going, hey, have you heard about this? Have you heard about that? And so, he introduced me to the NEUBIE, and also his heart rate variability testing, which we implemented. And that's just been an eye opener and really great to be able to pair with the NEUBIE and Master Reset. And knowing, and actually seeing how much changes we can make, not only in heart rate variability, but, in getting people out of pain.
Yeah, that's great. I'm so glad you brought that in or working that in. I think that's a missing link in many physical therapy treatments. And I'm just, so glad to hear you say that. And one other interesting dynamic about your practice, correct me if I'm wrong, but I believe it's all cash, no insurance. Is that right?
Yes, you're correct. So when I first opened up my practice, I remember sitting down with all the faculty member at Michigan State who were all in insurance-based models, 2 physicians and a couple physical therapists. And they all looked at me and they said, you need to just do cash. And I was like, really? Are you sure? That's kind of scary, because this is back, many years ago, right? In 2010 is when I first opened up. But
back before it was cool.
And before it was cool, and now everybody's doing it. So so I did. It's cash based, and we just have worked with that model where we really can spend that one-on-one time with patients. We don't have to have insurance companies dictating what we can do, what we can treat. If somebody comes in with low back pain, I'm probably going to be treating the neck. And so it gives you the freedom to treat the whole person and to give them what they need to get well. And then we assist them with giving them invoices and whatnot, so they can submit to their insurance company and, possibly get some reimbursement. So, that's always an option.
And part of that is in order to make that work, obviously you're able to have more freedom to do what you do, but there's also a component to that where you have to convince people to pay out of pocket, right? So
absolutely, yes. And so that, especially like I said, we get a lot of people that call that are like, well, like, what are you going to do for me, right? Because they've been other places. And so a lot of times, when patients call, if they're apprehensive about that, the first thing that we do is one of the therapists just gets on the phone and just has a conversation with them, listening to their story and helping to answer questions and to determine, well, are we a good fit? And I always tell patients, and, you know, I always emphasize this with our front office staff, is that, you know, when somebody comes in within a couple sessions, certainly by the fourth session, they should be feeling a difference. They should feel a difference in how they move. Now, sometimes pain can take a little longer, but usually there is a change. And I can tell you that I've caught more things than not when patients don't respond. And one of the faculty members that I teach with at Michigan State, Dr. Carl Steele, he started off as a PT and then, you know, became a DO, and he's the chair of our muscle energy course. And he taught me so much, but he always said, you know, if you treat something and it doesn't respond the way you would expect it to respond, then you should take a step back. And I have always done that. And I had a guy that came in that I treated for tennis elbow a year prior with tennis elbow, and he got better. He came in a year later, same symptoms. I did the same kind of treatment, but he got worse. And after, you know, 1 or 2 sessions, I was like, okay, time out, something's not right. And I referred him, and he ended up having a tumor in his elbow. So those stories have definitely come up. And, you know, so we try to reassure our clients to say, look, it's not like you're going to have to come in for 6 months, you know, obviously, unless somebody's had major surgery and, you know, there's other things maybe that are going on, but, you know, for the most part, we expect to see a change and an improvement. And I'm not going to just keep seeing somebody. And that's where I've tried to develop a really good network of other clinical practitioners. You know, sometimes it's mental health professionals that we need to have assistance with, or it's, you know, specialists in, you know, PRP and bone marrow, you know, types of injections. So depending on, you know, what the patient needs, then we try to work with our partners and people in the community that are on the same page as us, and you know, get them to collaborate and see if we can help in that way.
That's a great approach, and I especially like that concept of expecting to see results within the first few sessions. I mean, not only do you want to deliver value to patients, but like you said, it also has that diagnostic value, because you can tell how much of it is truly a musculoskeletal injury or issue or orthopedic caused pain, or is it something else like a tumor. So the fact that, you know, you're using things that work well enough that you actually expect to achieve results, I think that's crucial. I think that's a big point, and I want to hit that home for everyone listening. And there's also a good segue into the NEUBIE, and I know you've mentioned it a couple times, talked a few different ways about how it helps you, how you incorporate it. Can you just share a little bit? You also mentioned, you know, how you learned about it from Jason Waz, tried it out. Can you just talk about the process of fitting it in, how it's fit into your treatment process and overall flow at Back to Normal?
Yep, absolutely. So, you know, like we kind of spoke about at the beginning of the segment, you know, I like to look for game changers. And especially when you're in a cash-based practice, you know, you really want to know, well, what are the game changers that are going to get you the best outcome? So Michigan State, for sure, the training there and the, learning that model would be, you know, number one. The NEUBIE obviously is the other. And then ASTEM. I know that there's lots of instrument assisted types of treatments that are out there. I have found ASTEM just, you know, when I did some work with Major League Baseball, the therapist that I had worked there with had introduced it to me. And then Dr. Severe, who's one of the orthopedic surgeons who was on a team of people that developed ASTEM, I got to spend some time with him and really understand, you know, treating the whole kinetic chain, you know, which is, you know, again, the whole body and the whole system is really important. So what I really do is I will utilize, again, my Michigan State model, because I want to kind of wide view, look at the whole system. I always say to anybody that, you know, when I'm teaching, the mysteries in the history. So listening, you know, to the history and, you know, kind of just figuring out, okay, are there any red flags? What's going on? What are the main areas? And then getting into your exam where you can really figure out, well, where am I going to have the biggest impact? How am I going to make this change? And then from there, you know, I'm looking at, okay, you know, the difference between the joint mechanics and the soft tissues, and where do I think I might get the biggest impact? So I can use my muscle energy or my manual techniques. I can also use some dry needling to release any trigger points. And then I like to do the NEUBIE, and I love to do the mapping process. And oftentimes where those muscles are hyperfacilitated, maybe where there's trigger points, that's where the NEUBIE is going to pick up those hot spots. So now now I'm going to reintegrate through movement and using, NEUBIE to help reset the nervous system and reintegrate those movement patterns. And then afterwards, I'll do my A-stem. And I'll do my A-stem and then do a little bit of loading of the tissue. If needed, you can add some taping and then, send them home with the best exercise that is going to complement what we just did, right? So, if it's, I want to get the glute to fire and I want to open up, the front of the hip, I might do some self mobilizations, using some band work to open up the front of the hip so they can do some self mobilizations. If I feel like the spine is restricted, I might do some pelvic clock work and then, get the best glute exercise that's going to turn that on. Then once they've kind of moved forward with, okay, they're moving well, muscles are firing, I see that things aren't being inhibited. Well, now I can start integrating full functional, movements and move into the strengthening that we can do with NEUBIE or even, for mobility. I love using the NEUBIE on muscles that are hypertonic and just doing some mobility work. I mean, it just totally frees up the system. And I love the stuff you taught in the advanced course. I'm just making my way through the advanced course on the breathing techniques, because we do a lot with breath and, conscious breathing and using the relaxator. But I love how you use the NEUBIE on the lats, the serratus, and working through some of that breath work. So that's super, super effective if I'm trying to further integrate getting those flexion extension patterns reintegrated, is to use the NEUBIE now with breath work.
Awesome. I'm so glad you enjoyed that. And coming from you, I appreciate that feedback on the course there. That's wonderful. In terms of using the NEUBIE, are there any other kind of particular cases or stories that stand out in terms of, best use cases or just kind of highlights of the application?
Well, we recently had a patient that came in with a stroke, and he had already gone through a lot of rehab, and he had a tremendous amount of flexor tone in the arm as well as the leg, and he had a drop foot. So one of the doctors that I've treated personally referred him and said, hey, maybe Lisa can, do some things to help. And I actually reached out to one of your therapists to kind of collaborate with them on, best practices. And just after one session of, like, for example, using the glove, I was able to change his tone. And that's like incredible, because as you know, like, tone is very hard wired and hard to change. And we really couldn't do much with strengthening, right? Or trying to get activation. We wanted to deactivate the muscles. So mapping, so I mapped his upper quarter and I used the glove on his hand. And within one session, he was really flexing, anytime I would ask him to do a movement of anything, he basically would flex his upper and his lower quarter. Well, after that first session, I didn't even do anything to the leg, but he wasn't even pulling in his leg. and the arm was, more relaxed. And the second session, he was no longer stuck in that flexion pattern. His arm was more relaxed. So that I thought was just, that was really incredible, to see. Obviously, getting people out of pain and getting people moving, getting people to touch their toes is always fun, right? When they're like, I've never been able to touch my toes, and I always laugh and I'm like, okay, I should make a bet with you, right? To see if I can get you to touch your toes. So, yeah, so it's great to integrate, obviously when you get that tone to quiet down, whether it's something from a neurological insult or, just that neurological, input like the hamstrings. Right? I mean, the hamstrings are rarely an issue that it's tight and you have to stretch it. It's more, why is there so much tone in the hamstring? And when you figure out that, then you can figure out, okay, the best treatment and home program and things that they can do to maintain it. I actually had a patient just yesterday. She came in and she couldn't touch her toes. And she had that fear, right? She didn't really have any pain, but she had hurt herself from doing lots and lots of heavy training, and she strained. Well, she had some tendonitis, tendinosis of her hamstring attachment. But she would not. She went down, and you could tell there was this fear. And anybody who's been in pain, and I've been there. I had a herniated disc, and I know exactly how this feels. Where you just something just right in your brain just goes off and it's like, nope, not going to do it. So then I had her on her back, and she was able to do beyond 90 degrees of straight leg raise, and I could have her sit and touch her toes. So I knew it was more the brain that was the problem, right? So we did 10 minutes, we did mapping and some exercise. I did, a little bit of, treated one or two mechanical things. She got up and touched her toes, and she looked at me and she was like, whoa, what just happened? So, yeah, so those are some ways, that we're, integrating, obviously, with, the heart rate variability and using master reset. We combine that with the biomat. So we have a biomat and a bioacoustic mat that is, really wonderful. And we'll combine that with the master reset, and people just float out of here, and they sleep better. And, sometimes, when somebody comes in and they're just in so much pain, I will, I will do the master reset, and then we use essential oils, and I do a treatment called the aroma touch that helps with, improving the immune system, helps with pain and inflammation, bringing the body back into homeostasis, and kind of de-stresses that autonomic nervous system. And we know when, the autonomic nervous system is imbalanced and you got too much of a sympathetic load, then you have too much pain. And there's been several patients that they were so distressed, and their sympathetics were so lit up, and their heart rate variability was so low that just doing that, that made a huge impact. So, we can also use it in that way.
That's wonderful. Thank you for sharing that. And one quick follow-up question with the athlete you mentioned who had the apprehension around bending down to touch her toes.
Yep.
You said you did mapping with her, found her hotspot. So out of curiosity, because I've seen several different ways that can go, were her spots on the hamstring, any of the hamstring muscles themselves, or synergists, antagonists? Where were they?
Let's see, it was actually, I think it was low back and glute.
Okay.
Yep.
Interesting. Yeah. So sometimes you'll find something on medial or lateral hamstring. Sometimes you'll find something on a synergist or muscle in the same chain there.
Yeah. Sometimes you see it on the hip flexor, because a lot of times an over facilitated hip flexor will lock up the hamstring too. So
yeah. And that's one of the cool things of following the process, going through the mapping, is you'll figure out you may you normally, if you were thinking of using some sort of electric modality, likely would put it on the hamstrings for a hamstring, tendonitis, tendinosis injury. But the fact that you
Yeah.
did that and had that great outcome, and of course, if you have that outcome, that tells us you did the right thing, you gave the right inputs in order to get the right outputs and changes there. That's great. So
Well,
thank you.
and I think that that's a great point. So if you don't get a good, outcome, then one or two things: either A, you didn't follow follow the system, whether it's like our Michigan State model or the NEUBIE mapping process. I know when therapists are first learning, NEUBIE, it's like, they're used to just being able to put the pads on, right? Like, oh, the mapping process kind of takes a while. And I'm like, just follow the process. Because if you do, then you're going to get, your chance of getting a great outcome are much better. But if you don't, one is asking yourself, am I following those things? Am I in the right area? Or, is this something that really shouldn't be in physical therapy? And is it more of a referral, out of the clinic if it's not responding?
Yes, great perspective. I'm glad you said that. And as we transition to the final moments of our time together here today, let's segue one other place to talk about Rehab Links. So can you share with everyone who's listening what Rehab Links is?
Yeah, so Mark Bookout is a physical therapist that developed the exercise course at Michigan State. When I started teaching, I knew, because I had already taken the exercise and the muscle energy, I knew I wanted to be teaching in both of those courses. So I started teaching with Mark. And, Mark put together this amazing manual. And at the end of the manual, it had all these exercises that the therapist could take home and photocopy. Well, I knew that where we were going was away from paper and into technology. So I had talked to Mark for years about, we really need to take this and put it into, a system where it could be, sent an exercise where you could see the videos and the exercises, more easily to prescribe to a patient. So we worked with a company called Physiotech, and Mark and I went to Montreal and we filmed all of the exercises in the exercise course. And we basically cloned Physiotech into, at that time, Rehab Links, where any of the therapists could get that system and use kind of the terminologies and the different ways to identify if there was a problem. So for example, what we call an FRS dysfunction, so a segment that's flexed, side bent, and rotated, you could actually search what are the exercises that would improve that. So after you've treated that dysfunction, what can I give as an exercise? So therapists could go in and they could, pick that, and then it would shoot out the exercises and you could email it to a client. So we initially developed that. And then I always knew I wanted to bring more of the exercise course online. So during COVID, when we couldn't obviously teach in person, Mark and I worked together to develop Rehab Link Systems, which now is an online course. And initially, when we put it together, I wasn't able to do a lot of the videotaping and the filming, but that is the goal. I actually love the level 2 certification. I think I want to set it up similar to that. You give very small snippets of information and then kind of testing the knowledge of what you just learned. So I think that was really well done, and I'd like to take it to that level. But there's an upper and lower quarter. So either somebody who wants to learn about it can go and just sign up and start to learn about the movement patterns, and then what you can do to, restore mobility, get muscles activating again, and then what are the best exercises and things that you would do. So you have that. And then there's a membership where you can actually, you can go in, and we have an exercise library there. So if a therapist is like not 100% sure, they can pick the movement pattern, and then you can say, okay, with this movement pattern, what manual techniques would be best and most effective? And then it'll shoot out the manual techniques. Or what's home program should I give? And you can use that to help you figure out, you know, your treatment strategy as well as the home program. We also do some mentoring and do clinical pearls and a variety of different things. So we're continuing to try to develop that. So even people that have taken the exercise course, as you know, like that's why I love your online course. It's great to be able to go back, right? So you've taken a course and you only can, you know, digest so much information. Then you come back, and it's great to have that as a resource. So you can go back, read through, you know, look at, you know, how some of the exercises are done, look at some of the videos, and helps to give you that, you know, that reinforcement to keep utilizing that information.
Awesome. Yeah, the system for suggesting exercises and kind of having that algorithm built in, and then the educational resources. It's really powerful, excellent resources. And if anyone wants to learn more about that, the website is rehablinksystem.com. So there's two S's. It's rehab, LINKS, and then system. So two S's there, .com. And if anyone else wants to check that out, or follow you on social media or visit your website, what are some other places to find you?
Yep. Well, they can certainly go to back2normalpt.com. That's our website, and all our social links are on there. So our YouTube, our Instagram, and our Facebook. You can go there, or like you said, the rehab links. So those are the best places to follow us.
Wonderful. And it's definitely worth checking out if you're interested in what Lisa shared here. It's been a wonderful trip through the Michigan State curriculum, your experiences, your perspective. I really appreciate you coming on, and I think this episode is offering a lot of value to everyone who's listening. So I'm really grateful to you, Lisa, for not only being part of NeuFit Nation generally, but for coming on the show today and sharing your wisdom and knowledge. Thank you very much.
Well, thank you for all you've done with NEUBIE, and, you know, bringing this amazing technology to us so we can help more people get better.
That's right. It takes teamwork to make the dream work.
It does. You got it.
Yes. Thank you. Thanks everyone for tuning in, and we will see you, or listen to you, or speak to you on the next episode of the NeuFit Undercurrent podcast. Bye-bye.